help them to find out if they do have a problem, instead of giving them a pill that just gets rid of the symptoms.
Amen.
Like if you come to me and somebody's done an x-ray or something on you and tells you you have arthritis, I'm not going to give you ibuprofen that gets rid of your pain, but your bones are still breaking down. And it's also going to jack up your kidneys. I'm going to put you on that alkaline diet that my patient, his name used to be Rajon, when he 5 years ago, when he used to come to my office. But the alkaline diet, I'm going to teach you how to do an alkaline diet. I'm going to teach you first of all, I'm going to find out exactly why your bones are breaking. I'm not going to just say, hey, you're breaking down. I'm going to do some tests and tell you why you're breaking. Is it something that you're eating? Is it some sort of activity that you're doing? Something repetitious? Is it because you have a certain type of stress in your life? Are you being exposed to chemicals in your food? Are you being exposed to bug spray that's on your food? That nobody asks you if they can spray your food? So I'm going to find out why, and then I'm going to be your coach. And I'm a tough coach. I am not the doctor that tells you what you want to hear. So I have a lot of people that they look after they hear me. Don't fail me. I want to go. That makes me feel good when I come out. I'm going to tell you the truth, but I'm going to help you to get there. So the other thing is anti-aging. So it doesn't mean that you don't age. We all have to age, right? Okay, but you're not supposed to break down when you hit 40. You're not supposed to say, oh well, I have diabetes in my family, so that's why I have it. We all have genes for something. I can check and see if you have the gene. Okay, but just because you have a gene for something, it doesn't have to manifest. It depends on what environment you put it in. Genes disease will happen if stuff say, oh, this runs in, hey, diabetes runs in my family. Yeah, this is the recipe that runs in the family. Right. If you're at Thanksgiving and everybody has diabetes and hypertension, and the food is laid out there, and everybody's eating it, and you're eating it too. Watching TV. But the thing is, you don't have to get it. Right. And one of the reasons why I started learning this myself, I use myself as an example, is because everybody in my family has cancer. And basically, there's only 2 of us left. Everybody else had the gene. My husband's family, all the women in his family have the BRCA. He's the last one. His mother, all his sisters, they all had breast cancer. Even his nieces, they all had breast cancer at young ages, and they're gone. So, so he's with me. He's not going to get anything. And he did have some things when I met him, too. So he's cool. So that whole thing about, we're programmed to think when you get a certain age, are you not supposed to do this? Or you can't. Forget about that. You have to remember, this whole system is based on profit. The whole medical system is based on, and the sicker you are, the specialists who take care of advanced disease, they make twice as much money as I do. Why? So what's the incentive for them to tell you what to do to not get help? Right? So at any rate, I just wanted to let you know that that I'm here in St. Louis. I use myself as an example of health. I see a lot of my patients here. And my newest patient is a little vegan baby, Messiah. That's my latest patient. And you can see how beautiful that child is. And you don't have to eat something dead to get protein. I've been a vegetarian for 40 years. Okay, and I actually am stronger. I started lifting weights about 5 years ago. And I'm stronger and healthier now than I was when I was 21. So it's possible. Rethink that whole protein. Rethink about what you eat. My motto is